I had a long-time research interest in pediatric neurodegenerative diseases that took me on various trips here, there, and everywhere. And one of my research projects took me to Kingston, Ontario, to Queens in 1982. And I did some of this neurodegenerative work and was asked to see a young lady who was in an institution north of Kingston who was 12, and they thought she was deteriorating. And so here's the deterioration doc coming up, and so I was examining her, and I was really not convinced that she was deteriorating. She was a happy camper. Yes, she wasn't keen to do much walking anymore, but I could get her to go, so I'll give her 6 months. In that interval, one of the pediatric neurologists in Kingston asked me to see 20-year-old twins with seizures, and rest the question, could they have Rett syndrome? And I said, what the heck is Rett syndrome? I never heard of it before. Well, I happen to have this paper, which was just published. And I read it, and I said, no, these don't have Rett syndrome. And forgot about it until I went back and saw Jen. And then she came doing this, and I thought, oh my goodness, she's got Rett syndrome. And so that's fine, and went to a meeting in Baltimore, and people got to know this. And Dr. Rett came to Toronto, and I was one of the few people around that had experience with Rett. Had 2 patients by then. But as a medical geneticist, I was someone who could speak to why this is only girls. So Dr. Rett had me join in some of his clinics, met some more, and it just built over the years. And then this other family came to town because they heard I was the medical geneticist at Kingston. They lived nearby. And of course, this is Terry Boyd and her family. And one thing led to another, and they began to develop ORSA. And I left Kingston in '92 to take up this position in Victoria. But traveling across Canada, I stopped at various homes and met various families. And then I traveled to Vancouver once a month, and I saw most of the patients who the Rett syndrome diagnosis had been at least raised clinically. And at that time was, your experience told you whether this is Rett or not. And then, of course, in late 1999, they found the gene. And we set up mutation testing at a research level at UVic in 2000. And that allowed me to expand that up to involve more people. And of course, ORSA by then was growing and would have these regular clinics. And I would visit and meet the family and do family histories, examine their daughter, and draw blood. And by then we had a national consortium of people testing for it. And with ORSA sponsorship, we added that in and eventually published our experience on 100 cases of Rett syndrome where mutations were found. One of the families who were very early on in the establishment of ORSA's traveling clinics and things had a daughter who nobody could find her mutation, including us. But then some people at Sick Kids looked at it again, and bingo, they found a unique mutation. So here's an ORSA family with a daughter with Rett syndrome who finally has the diagnosis made, and she was the only person in the world at that time who had this mutation. And that's because people weren't looking in that part of the gene anymore, because they'd done that in the early days and nobody found anything. And so why waste time and resources on that part of the gene? And yet, boom, that turns out to be the most important gene, because the protein it makes is most important in the brain, whereas the protein of another portion of the gene is in different parts of the body. And so that sponsored even more investigations, and eventually it contributed to an emphasis on raising money for research. And as you heard, last year they dispensed $100,000 in research grants based on the various fundraising activities of Run for Rett and et cetera, et cetera. So I've been labeled, as of this meeting, the grandfather of Rett syndrome in Canada, which is a bit of a joke. But I guess so. I mean, I was there from the get-go, and I've been a long-time member of ORSA. And with my experience with these other families, helped contribute to the development of the Rett Syndrome Registry, which is terribly important because now at this meeting we had all this discussion of clinical trials, and we have to be careful, having taken a page from the experiences in particularly the United States, where companies are really interested in getting access to patients with these rare diseases. And so the FDA has set up a sort of a set of things you have to get in the game. And one of them is a registry. And the second one is natural history studies, which we have. So we've got all the things in place. The registry then is going to expand to have a research component, which is again voluntary, but the researchers can apply to the registry for the research families, but they're kept away from the families in as much as there's a broker in the middle, the research registry, that makes sure that those researchers and those families are meeting all the requirements for ethical approved clinical trials. And so ORSA, again, has led the way across Canada in being the most visible parents organization in all of Canada with respect to Rett syndrome. And in recent years, they've begun to really encourage smaller cohorts of families in the provinces like Alberta and Manitoba, and now most recently Vancouver, to set up Rett clinics. Because there's a tempo, as you sensed listening to the meeting yesterday. The drum beats are rolling and it's coming and it's going to happen. On the other hand, as a medical geneticist, I deal with the rarest of the rare diseases, and I'm sitting there watching the most incredible developments, not only in diagnosis, that's passé now, it's in therapies, treatments that are different ways of tackling the different genetic conditions. And many of my patients are beginning to benefit from new technologies that were just beginning to play out for the treatment of rare diseases. And everyone who got involved in the get-go from Rett syndrome agrees that these children and young adults are different. And to use a sort of a hackneyed phrase, the lights are on and somebody's home. And boy, that's a hook, that gets you. And then along comes the research results from Scotland and Dr. Bird's lab showing that you can rescue the phenotype, that is, restore it by doing certain genetic manipulations of the gene. And then that became a focal point of research here in Toronto in the Eubanks lab. They established a mouse model and they demonstrated, yes, you can do this and it makes things better. And now we're looking for these new techniques to repair the gene itself. At the same time, because it's a lot better established, our clinical trials looking for small molecules, drugs, proteins that are available now for testing for whatever condition you want. So the FDA in the United States has released a list of about 75 pediatric drugs that have been vetted by FDA as being safe and effective, so that they don't have to go all the way through the whole process again of proving it's safe and effective. You can apply this to some research model to see if it's effective in Rett syndrome. So this recent round of grant applications for this year's funding have 4 state-of-the-art applications, each one using different techniques to screen drugs. There are 4 different techniques. They're screening drugs. You'll see a lot more in the coming year or so how much success they've had in finding something that affects the neurons in a positive way, and we'll see clinical trials. As you heard yesterday, there's one starting here testing a certain hypothesis. Then we hear from Dr. Katz about the use of ketamine, which is universally available, that helps. So I just think that in the next 5 years, people are going to be banging on the door of the Rett Research Registry to get access, because there'll be so many exciting possibilities of therapeutic interventions at the small molecule drug-related ketamine stage of development. But at the same time, there are techniques that cure genetic diseases. The most recent one is a genetic technique that has cured a patient with sickle cell disease, which is a common recessive disorder among the American blacks and other communities, but particularly in North America. Cured the disease, not treated it, cured it. I myself have a genetic condition recently diagnosed that affects my vision, and looking into that, they found a technique to cure that using some of this new gene therapy. So I'm sort of interested for my own sake how that's going to play out, but I'm also convinced it's going to play out for Rett. And then once that happens, look out in terms of how it's going to affect other conditions, in terms of these other rare diseases, which are not that rare when you put them all together in Canada.